Mike. Good afternoon to everyone. Thanks for joining me for weekly news discussion. I'm pleased to be joined today by Dr. Jose Romero of the Department of Health. We also have Secretary Larry Walther, Department of Finance and Administration. We have Pat Fitz here, Executive Director of the Arkansas Game and Fish Commission, and we have Eric Hagler that's here, who's the Director of the Arkansas Scholarship Lottery. Let's start by reminding everyone that this weekend is Memorial Day weekend, and it kicks off the summer vacation period. And we should remember a few things as we enter the Memorial holiday. First of all, the reason for the holiday, and that is to remember those that have given their life in service of our country. And it's an important holiday for that reason. But it's also a time for family, it's time for traveling, it's time for enjoying our state parks, and a time for seeing our rivers and our lakes. And so my admonition is be safe as you travel, be safe as you go into our rivers and our lakes. Make sure that you remember this is National Safe Boating Week, so wear your life vest and be safe as you enjoy the wonderful outdoors this season. And I'd also encourage you to remember that we have vaccine clinics at 3 of our state parks. And if we could put that first one up, slide 1, it has go back one. There. The state park vaccine clinics. DeGray Lake Resort State Park will have a vaccine clinic. The times are referenced. This is all on Saturday. Mississippi River State Park, Pettigene State Park. And we have some good news and announcement for those that will be going to those particular clinics, and that those receiving the COVID-19 vaccination during a state park clinic, as identified here, they will automatically be entered into a drawing to win a gift certificate for 2 nights of lodging of their choice at any of the Arkansas state parks. Now, if you then go to the slide that talks about where we are in our vaccinations, 50% of Arkansas adults have received at least 1 dose of a COVID-19 vaccine. Now, this is below the national standard or national average, but it is progress for Arkansas. 50% of all adults have received at least 1 dose, and that's according to the Centers for Disease Control and Prevention. But it shows that we have more work to do, and last week, as I announced the incentive for state employees to get vaccinated with the bonus that's available to them, people ask me, well, how about the general public? You've got to do something to encourage the general public to get vaccinated, and I've asked our health department team to combine with our Department of Finance to see what we could do to give something to the general public to incentivize them, encourage them, and also to make it some fun as they go about getting the vaccine and we increase these numbers. And so with that, I wanted to announce 2 additional incentives that will be effective and available beginning next Tuesday, which is June 1. And first of all is you'll have 2 options, and that is that you can get a $20 Arkansas Scholarship Lottery scratch-off. Which I'll ask Eric Hagler to come in a moment and describe this in more detail, but this allows you to scratch off, get an immediate decision as to whether you've won an award or not. But for those who say, well, I don't particularly, not interested in that, I'd rather have a different option. And that would be a gift certificate with the Arkansas Game and Fish Commission for $20 or roundabout numbers as well. So there's an equivalency there. Now, if you choose to get the Game and Fish Commission gift certificate, that can be redeemed for a fishing license or a combo hunting and fishing license. And Pat will come and describe a little bit about how that works. Now, these will be distributed at our local health units and at special events across the state. And so you can only redeem your vaccine card, and it has to be a vaccine given from this day forward. And so tomorrow, if you get a vaccine, you get your vaccine proof of vaccination. You can take it next Tuesday into your local health unit, which we have in every county, and say, I want my scratch off, or I want my gift certificate from Game and Fish. And that will be available to you. We also hope to have special vaccination clinics from time to time, in which they will be immediately available if you go to that particular clinic to get the vaccine. We're going to be allocating 50,000 lottery tickets that will be purchased by our Department of Health and distributed as incentives, and we'll be purchasing 50,000 Game and Fish gift certificates as well. This totals $2 million that we are devoting to this incentive plan, and if it is successful, if it actually encourages people and we increase the number that's getting a vaccine, then we can increase that funding and put more resources into it. This is funding that we have at our Department of Health that's specifically designated for vaccine distribution, and it's been approved that it can be used for incentives as well, and that's how this will work as we present it. And so at this time, I'd like to have, let's start with Eric, if you'd come and talk about how the scratch-off will work.
Absolutely. Thank you, Governor. On behalf of the Arkansas Scholarship Lottery, I'm very pleased to be partnering with the Arkansas Department of Health and the administration in furtherance of this immunization program. And we're pretty excited about the offer on the option of the lottery ticket. This is the $1 million spectacular ticket. And this is an important ticket for those that are interested in getting their vaccine, because what this offers you is an immediate chance to win a $1 million cash prize. There are currently 2 $1 million prizes still in the game, and over $19 million in total cash prizes. So what that gives you is a 1 in 3 odds of winning some prize with this ticket for getting your shot. There's a bonus. If you scratch your ticket and it doesn't win, go to our website, myarkansaslottery.com, enter your ticket number for a second chance to win $1 million. So you actually get 2 chances at winning $1 million. Remember, you have to be 18 years or older to play, and we ask you to play responsibly. You could be Arkansas's next millionaire. Thank you.
And Director Pat Fitz, could you come and talk about how the gift certificate through Game and Fish works?
Yes, sir. Governor, thank you so much for letting us take part in this, and we're very excited. It's kind of fitting as we move through the pandemic that we saw a big influx of people go outside and spend that time in our natural resources around the state. And I think this is a fitting incentive to keep people out there. So like the governor said, when you, starting today, when you get your immunization card, you'll be given 2 gift certificates, each one for $10.50, and that represents a fishing license and a small game hunting license. So you'll get both, and then you'll be able to redeem that gift certificate at any licensed dealer or online to get your actual license. So we would like to encourage people to come forward and take part in this program, and certainly get your incentives and get outside and enjoy the great outdoors here in Arkansas. Thank you, Governor.
Thank you. And previously, you'd get a vaccine and you knew you were doing something good for your health and your state, and that was a reward. And now we're not only you get a vaccine, you're doing something good for yourself and your health, but also you're going to be helping the Arkansas Scholarship Lottery, and you're going to be helping also the Arkansas Game and Fish, and hopefully expanding those that utilize our outdoors. And with that, let me go to the final slide, which is the current case report, just to let you know that there's a reason to get a vaccine. And you see that we have 329 new cases, a change from yesterday. Active cases are up 96. The good news is that we have given out, had a good vaccine day with 9,378 doses given. But it's a reminder that we still have the COVID-19 virus in our community. There's a reason to get a vaccine. There's a reason to get a vaccine, and that is that we've got to make sure we beat this. And with that, Dr. Romero, I'll give you the last word before we open to questions.
So simply to reiterate that we are seeing more cases this week than we did last week at this time. Our deaths have increased by 4, all of which have been confirmed by either PCR or antigen. Our testing rates continue to be solid in the lower range, but have not budged. Overall, vaccine distribution continues forward, as mentioned by the governor, and I'd like to report that 6.4% of our 12 to 15-year-olds have been immunized as of today. That number is increasing progressively. So it's being uptaken by the parents and in that group. So we're making headway and hope to continue to expand that significantly now with these incentives that are going to be in place starting today. So thank you very much.
With that, we'll take any questions.
Last week you made reference, somebody asked about the lottery, and you said there were some restrictions. This doesn't run afoul of the restrictions you're referring to?
No, the restrictions I was speaking of is that there's really only one lottery that's allowed, which is the Arkansas Scholarship Lottery. That is the lottery that's permitted. Some states create their own lottery within the vaccine cards, and so you have a lottery just within their Department of Health to encourage vaccines. We could not do that, and so that's what I had reference to. And so the way you avoid it is we operate within the existing lottery program by the Department of Health purchasing 50,000 scratch-off tickets. So that is consistent with the law and with the exclusive nature of the Arkansas Scholarship Lottery.
I mean, are those slow-selling tickets? Is there a particular reason you chose that $20 ticket?
Because it was $20. No, I mean, Eric, you can handle that, but we wanted to have an incentive that was in that range, and so that's why I picked it, but you can comment on...
These tickets you wouldn't sell otherwise?
To the contrary, this is one of our most popular games. We felt like to incentivize individuals to participate in the program, you have to give some value, and this was premium value, so actually this is what we consider to be a premium game.
Seems like a pretty high increase in cases today. Any idea what's going on there?
You just got to watch it week by week. Last week, I think we had like 317 new cases, and so it's a little bit higher, but it's comparable. And then as the week went on, it was high, and then it went down. And so week by week, it's fairly steady, but obviously anytime you get over 300 cases, it's worrisome. And there's only one answer to this, and that is increasing the number of vaccinations.
The increase could be due to perhaps more people traveling or more people taking off their masks.
Dr. Romero, I'm going to let you answer that.
I think it's multifactorial. The increase is probably due in part to travel, in part due to not adhering to the mask issuance. That is that, you know, if you've been vaccinated, you don't need the mask. But if you're not vaccinated fully, then you need to continue that. So that's probably playing into it. The other issue that we need to consider are the number of variants that we're seeing. So we saw a 36% increase in the number of variants that we have identified in the last week. That's another reason to get vaccinated. We know that those variants have higher morbidity, mortality, and transmissible. Over 1/3 of those new variants were of the UK type that is transmissible, and we're starting to see some of the Brazilian variants here in the state, which are difficult to treat with our monoclonal antibodies. So really, the only way to prevent this is, as the governor has said, and as we've said over and over again, you need to get vaccinated. That's how we're going to stop this pandemic here in the state. Thank you.
I don't know if we have anybody remotely that had a question.
Yes, hello, this is Mercedes McKay with Channel 11. I was just wondering for Dr. Romero, why we're seeing hospitalizations rise as well. They got up to 200. Why are those rising? Is it because of the variant spreading, or what does he believe the reason is?
Well, Dr. Romero, why don't you answer that, but I think you have to put it in perspective that we're really below 200. So why don't you comment?
So the governor is correct. So the thing to keep in mind is that we tend to see spikes in the hospitalizations usually today on Tuesday, and then they tend to trail off over the week. So this fluctuation isn't unusual. Our overall average is still in that 100 to 200 range. Again, you know, we need to vaccinate. If we're not going to vaccinate, then this is what we're going to see going forward, with a potential of spikes as the season gets colder and we spend more time indoors. So please, we need to do this in order to cut down the number of hospitalizations.
Next question.
How are we doing on the vaccine goal? Are we on track to do
In terms of the general vaccine goals that we have, as I've said, we're behind the national average. Our vaccinations have increased because we're added the 12 plus, and so they're continuing to get vaccinated, as well as the push from employers and other incentive programs across the state. So I'm much more pleased this week with our vaccination trend than I have been in previous weeks. I think it's picking up. People are continuing to get vaccinated, and we just want to continue down that path. With that, Mike.
Question has come up from Andrew, the auditor, Andrea Lee, the past two finance boards, about how much surplus money you want to stick in the health insurance plans. Nobody put out a number. I just wondered if you could clarify if you've actually determined how much money or when you'll decide that.
The answer is no. That hasn't been determined yet. The Department of Finance and Secretary Walther is here, who chairs it and is working very hard on that, and if you want to come up and address that, but we have to wait to see what the recommendations from the from the Board of Finance as to you know, whether there's going to be revenue increases, whether there's going to be changes in service. So there's going to be adjustments beyond simply we need to plug it with more state money, but that is one of the options and one of the things we'll probably have to dig into. Larry, that good? All right, and we can provide more on that if you get.
And then the question came up at the Legislative Council meeting about merit raises. When are you going to decide on that for state employees?
Where did that question come up?
Legislative Council?
Yeah. There's been no decision on that, so we will do it in the normal course, but we have no announcement to make and no time frame for it right now.
So the decision's not going to be based on the revenue report coming out early June?
Well, it's not, I mean, we'll have the revenue report as a separate issue, and then we will make the decisions on the merit increase, but I don't want to give you a specific time frame on that yet. Thank you. Have a good afternoon, everyone.